Sure. Good afternoon, everybody. My name is Alex Gossage. I am Executive Director for an organization called Disability Network Washtenaw Monroe Livingston. We are a Center for Independent Living, which is a community-based organization that provides services and supports to people with disabilities all across the country. And I have had the privilege of working with a number of the speakers today on projects over the years and partnering with the University of Michigan and Michigan Medicine to bring more disability perspective to the various research projects that have been going on. So I appreciate being here today. Um, Steve or Laura, I didn't know if you had a question you wanted to start off with, or if you'd like me to start off with a question, that would be fine.
Well, why don't you, Alex? Go ahead.
All right. So I know one of the things that you were talking a lot about had to do with the interprofessional collaboration and the barriers that you all are seeing and expanding this amongst your various um, different programs. But how can we make sure that disability perspective is central in interprofessional training models in education, especially amongst such a diverse population of people?
There we go. All right, this is Steve speaking. Hey, um, to increased awareness, I think is a place to start. Increase awareness of what we're lacking within our curriculum and within our opportunities for students, and not just our students and but also other learners, our medical residents, pharmacy residents, and then our healthcare professionals as well. Um, I think by increased awareness, we'll we will then be able to identify where the need is within our learning opportunities and be able to expand it beyond that. I'm encouraged. Just in this last 6 months, I've noticed a number of different programs, web-based programs for educating practitioners today. For example, a recent one came out from the National Down Syndrome Society about educating practicing physicians and clinicians about Down syndrome and the needs for healthcare there. I'm starting to see more and more efforts to increase awareness and give educational opportunities. Special Olympics International is another that's developed a suite of educational modules for all healthcare professionals. And so yeah, I see actually this last few years and even more recently a groundswell of increased opportunities for education.
Great, thank you, Laura. Did you have anything you'd like
Yeah,
to add?
I was going to build on what Steve said briefly is, this idea of awareness, but there tends to still be the reservation that someone brought up earlier that like everybody is like too busy to do it. So they might at some point be developing awareness, but trying to swing the needle to the commitment, like we are committing to training, we are committing to talking about it, we're committing to changing our culture. From an educational standpoint, I often wonder like are there any accreditation standards, right? So we had accreditation standards starts interprofessional education started creeping into accreditation standards for different programs. That was actually a good thing because it helped people have to take action. So you really look at, what level can people really step back and say, yeah, we have awareness, but we still don't have time to get it in our curriculum. Like if you want to do it, you'll have to just do this training later versus we're going to take a commitment. And even if it's a very small but intentional commitment where people feel like they can not add to what they're doing, but maybe to replace or enhance training that they're doing, I think would be a really kind of cool thing to look at in the future as well.
Thank you. Um, Another thing that I was kind of thinking about as we were going through the presentation today, and I really liked seeing the picture graphs that you guys showed with kind of the changes in attitudes and thoughts that folks and perspectives that folks had as they went through this training. How do you think this kind of training better prepares providers to meet the needs of people with disabilities and keep them centered and part of the health process? In making sure that those folks are being able to maintain control of their health.
Um, with our training especially with your last point, to increase the clinician's awareness and then helping the patient who has a disability to manage their own health. Again, by all I can do is keep going back to the increased awareness of the needs of the population that's required for example, self-management and self-care, and for basically for the health provider to learn from the person with a disability of what their needs are for management, but also I think some of the unique uh, uh, ways that individuals manage their health and their and learn from the patient in that way as well. Um, I think this is key for health professionals to really work with their patients and help them move ahead, is to be able to provide the evidence base that they understand, but also to work with the individual based on their needs and accommodations, but also their lived experiences. Others' thoughts on that? Okay.
This is oh,
Yeah.
sorry, it takes me some time to coalesce my thoughts.
Yeah.
I really appreciated your presentation. And what I was thinking about in that changes of attitudes, one word that stuck out to me on the right side of that picture of that word art, I think it was like the fifth largest word was human. And so that's what that was really sticking out to me is not just increased awareness, but I think the challenge that healthcare really faces is humanizing their patients. And this isn't something that we just see in disability. I think we see it in a lot of the health disparities that people face for a variety of different identities that they might hold. And so that's what I really try to push for in any type of curriculum is the humanity, and that's why I really respect models of curriculum development that center and empower people with disabilities to actually be a part of that creation process for the curriculum, and even part of the delivery process, and not just sort of a beneficiary of the product, if that makes sense.
Absolutely. Thank you. You know, I'm just going to say one of the things that strikes me about the presentations this afternoon in our segment here was exposure. Exposure has an effect, a very positive effect, in a number of different constructs that are being measured. And you just can't take that away. That opportunity for learning about other individuals that are unlike you, who have different lived experiences, that can enhance an individual's understanding, not just in healthcare delivery, but in life in general, and the way you go about your day-to-day business. I mean, that's again, some of the comments that I've had from students was this course is the course that we offered with the experiences they had go beyond the healthcare setting. It's understanding the grocery store, every all aspects of person's lives and what they do and interaction has been very positive. So the exposure opportunity cannot be underemphasized, or it can't be overemphasized enough, I think. I just wanted to make that point.
Yeah, thank you, Steve. I really appreciate that point as well. I've been doing the work in the community for 20 years almost now. And I think the one thing that we see again and again is just how people view things changes over time. If we're talking about accessibility and individuals starts meeting people with different disabilities, they start to see the barriers that exist in the community that maybe they weren't actively noticing in the past. And they just start to look at how we can change things and what we can do. And it really creates, I think, a lot more of dynamic partnerships. I think the work that we've done together has changed dramatically over the last several years. And I've really appreciated being able to see that and being a part of that. Are there other things that organizations like mine or the Center for Disability Health and Wellness can do, or is there a role we can play in the interprofessional education and supporting the work that you are doing, or furthering the work that you all are doing? Or have you found any best practices with engaging the community at large?
Well, as we expand our opportunities, we'll come knocking at the door for people to work with our students. Absolutely, that's one way. Being able to have when we talk about 3,000 students and how many interprofessional teams that would make up, that's a daunting task. And but on the other hand, working with community partners to be able to do that would just be wonderful opportunity. So yeah, continuing that relationship that we have, and making it work synergistically for that would be that's one that I can think of.
I think another one that I look at is, we have so many resources on our campus. I mean, if we just look at the different um, centers and organizations, community partners, we look at all of our networking just even in this meeting, and to look at a way, to really rally together in order to infiltrate practice settings, whether that's clinical practice, community health service, because I struggle with, we are creating this ideal for our students, like truly what it should be. And then my heart breaks a little bit because I'll hear from students, you kind of painted this picture that's not realistic, Dr. Smith. Like, we got to the clinic or we got to our community project and we didn't even talk to anybody. We just went in and we like did our thing with our whatever task we were given, and then we left. And so for me, one of my dreams is, how do we create a culture of collaboration, really a community that feels strongly on raising disability awareness, being able to provide care, but really to be part of a team that is committed to getting the client the resources that they need. So, as the physical therapist, I don't need to understand all dimensions of the hypothyroid medication, but I need to feel very comfortable to advocate for my client or patient and their family with other providers in a way where my communication makes sense, that I'm confident, we respect each other's roles and responsibilities, and it's not like a game of hot potato. Well, I don't want to deal with the medication, you do. Well, I don't know a pharmacist. Well, imagine that world. And I think about, if we look at collaborative team-based care where everyone is committed to having at least a basic understanding of looking at a client's situation through that social model of disability paired with your medical model lens, and looking at all of the strides that we could make, for the overall care of our clients. And so for me, that's like a dream where we could have this center and that center, and we're all rallying to really change the practice setting, because we're getting the wheels going on the education end, but then we send out the students and sometimes new providers, and they feel like they're in a different environment. So I'm just curious if anybody else maybe has experienced that or has ideas of how we can grow kind of that practice feeling. And I heard someone earlier say, looking at our clients as educators, like really bringing in that model. Like, do clients need some training so they are like putting on the I am an educator coat? So I just be curious to hear from others if this is something that maybe gets you something to react to.
Well, I'll jump in. you know where I'm on that. We need to do that. We need to have under the client as the educator is the central piece for this work. And what are the needs? What are the needs of the client? What are the needs to feel comfortable standing toe to toe, or even, if you will, anecdotally above the health professional who they are the ones educating the health professional. What sort of tools do people need, not only in these educational experiences, but in your day-to-day life and day-to-day practice? When you see the doctor, when you see the pharmacist, when you see the physical and occupational therapist, nutrition, all the health providers you may see, to be able to be the educator in your clinical day-to-day life, but also in these educational opportunities that we do provide.
This is Samya speaking, although I recognize that Dr. Mead just turned on her video. I'll be quick. But there was two things I was thinking of as you both were speaking. One is that I didn't really talk about the setup of these adaptive sports events that I talked about in my presentation. But something that's really beautiful about it is that, you know, a lot of the staff in ASF are people with disabilities. A lot of our coaches, a lot of our athletes are people with disabilities. And this experience of teaching them in adaptive sports is not really, you know, teaching them like what they've learned in their health professions curriculum, but it is still an experience where you're going to start playing wheelchair basketball, and the person who's teaching you is a person with a disability, and they are going to kick your butt. They're going to kick your butt at that sport. And I think that I haven't really explored this in the research, but I'm curious to know how even that experience alone really changes, you know, how people perceive people with disabilities, or health profession students perceive people with disabilities. And just like I think there's no experience quite like that one. And then the other thing that I was going to mention was that I think that UIC, where I'm doing my PhD, has a really beautiful model that they're working towards, of patient instructors, where it is a simulated patient interaction, and University of Michigan has something similar, but in that process they are having the instructors talk directly to the students about the ways that they could improve in their communication, ways that they could, you know, like if they are feeling seen as a person. But I, you know, truly I can't address what Laura had talked about, you know, how do we translate that into the real clinical practice and like face the challenges directly there. But thank you.
And I'm going to jump in here. And I know where I'm not quite on task in terms of closing up. So that's not about it. But I did want to add that definitely individuals with disabilities, patients are our partners. We also, as clinicians, as researchers, need to respect the lived experience and the expertise of people with disabilities, of patients, about their own lives, about their own bodies. You know, if we don't listen to that, if we don't hear it, there's a problem. Health happens not in a clinical setting. It happens in home with regular everyday behaviors. It happens in the context of relationships and other priorities and activities. And I do think it's important that advocacy training occur and that people with disabilities and patients are engaged as simulated patients, are engaged as educators. That said, I am concerned that we expect, and what I hear from many folks with spinal cord injury, is that providers don't know anything about disability and they expect the patient to teach them. And that is not a fair or an appropriate position to put them in. Yes, they need to listen, they need to respect their experience, but they shouldn't be looking to the patient to do all the work, to give them all the understanding. Many people come in, especially if they're earlier in their journey, and they're scared. They're worried. They really are looking for the knowledge and expertise. And so it is a matter of a collaboration and a partnership. the healthcare provider is responsible for gaining the information, the understanding, and then partnering with the individual, with the patient, to figure out how this applies to their life and to help them optimize the outcomes and to share decision makings and help them to meet the priorities and goals that make sense to them. But we can't expect the clinician, patients to know more than us. We can't expect them to be the connecting point for all our collaborations with our colleagues in specialties and other disciplines. We have to take responsibility for doing that, both as healthcare providers, as a system, and as researchers.
Wow, thank you, Michelle. One thing I was going to add, and I definitely I agree that we can't always put the onus on people with disabilities to teach everybody else about their disability experience, their lives. But Steve, I do have to wonder with collaborations like this and community organizations like this, I do like the idea of maybe community participants having some self-advocacy training done prior to meeting and interacting with the students. And then, that's something that we can't assume that just because somebody's volunteering to participate in something like this that they have. And it's something we've been talking a lot with my colleagues at my office. When we think about health access and we think about the relationship between patients and providers, we're feeling the need to really make sure that people feel comfortable and understand and know how to advocate for themselves in their own health experience. So I think maybe that's something we should talk about in the future as we look at moving these programs forward.
Absolutely, Alex. We'll be in contact next week.
Well, I think we are about at the end here of my section, if I'm not mistaken. But are there any other final comments or um, anything else anybody else would like to say before we move to the next section?
I guess the other piece, since I'm already jumping in, is if we're going to expect individuals with disabilities, patients, to be educators, we have to pay them.
Mhm.
We cannot expect them to be volunteering, to be always donating their time. We pay other honorariums to other presenters, other people involved. We have to think about valuing their time in the same way and providing that same consideration.
Yes, thank you. Absolutely. And I think we have seen a huge shift in that over again, the last 20 years that I've been doing this kind of work, we've seen a lot of that shift and to see that from a large institution is something that somebody from the community I think can feel really good about because those shifts take time and those shifts in perspective take time and we're seeing them and I think we're benefiting from them as a community as a whole now too.
I know I wanted to thank you, Alex, and all the team here on behalf of the Center for Disability Health and Wellness for your involvement, for your partnership with this this conference and with just advancing healthcare in general. This is really what the conference is about, the teaming together. I think both this section reflects that idea and that importance and this discussion as well. It really is about working together, about figuring out how do we keep moving things forward. Had a discussion the other day about we are moving the ball down the field. We're seeing progress. We're not there. We're going to fumble. We're going to make mistakes. Things are occasionally going to get dropped. But by working together, we can get so much farther and we can create a team that really is there to provide one another with support and encouragement to strategize and to help deal with the hardships and the booing and that whatever changes are there. And I think we're really fortunate, both here at the University of Michigan in our community, to have so many partners, to be finding so many people who are interested and passionate about this work and collaborative, to keep working together to make improvements and to make changes and to really think that most people want to improve the health outcomes of people with disabilities. No one's going to say, yep, I don't really believe in that as a goal. They just may not think about how to do that or what's different or, how this really works. And then, I think especially with the healthcare field, one of the things I really heard is the importance of the social model, not making sure that people realize too much times medical schools do apply medical models. They think about disability as something that happens to patients, that they're the experts about. Where really what we're pushing and what this whole conference is about that collaboration, about seeing the social model, seeing that it's not just one thing, but the importance of the attitude and the knowledge and the perspectives and the environments that we have here in healthcare, that we teach our healthcare students and our clinicians, and that we really provide resources to support when we provide healthcare.